Hi everyone, myself Abarna Suresh. I am MSW second year student of Sri Shabarish College, Kerala. Today's we are discuss the course titled Clinical Assessment and Diagnosis of the Psychiatric Disorder. I will dealing with the topic overview of the diagnostic guideline. Neurotic and behavior syndromes are a group of psychological disorders characterized by excessive anxiety, maladaptive behavior, and distress that interferes with daily functioning. These disorders are less severe than psychotic disorders and typically do not involve loss of the contact with the reality. Today, we are discuss the common disorders, anxiety disorders, obsessive compulsive disorder, somatoform disorders, dissociative disorders, stress related disorders, adjustment disorders, and eating sleeping disorders. Okay, today we are discuss the first disorder is anxiety disorders. Anxiety disorder. Anxiety disorders are characterized by excessive fear, worry, and physiological arousal that interfere with daily functioning. The anxiety disorder, three types: generalized anxiety disorder, panic disorder, and phobic disorders. What is generalized anxiety disorder? Generalized anxiety disorder is a mental disorder characterized by persistent, excessive, and uncontrollable worry about everyday things. This excessive worry often to interfere with daily life and accompanied by physical and physiological symptoms such as a muscle tension, restlessness, irritability, difficulty sleeping, and problem concentrating. The anxiety disorder symptoms: restlessness, muscle tension, irritability, sleeping disturbance, difficulty concentrating. The causes of anxiety disorders: genetic predisposition, chronic stress, neurotransmitter imbalance. The treatment of anxiety disorders: psychotherapy, the cognitive behavior therapy, and medication, relaxation techniques, and lifestyle modification. Next, the panic disorders. Panic disorders is a anxiety disorders characterized by two recurring unexpected panic attacks. Panic attacks are a sudden period of intense fear that may include palpitation, sweating, shaking, shortness of breath, numbness, or sense of the impending dooms. The maximum degree of the symptoms occur with the minutes. The symptoms of panic attack: palpitation, sweating, trembling, shortness of breathing, fear of the dying to looseness, not control of breathing problems. The treatment of CBT and relaxation therapy, antidepressive, etc. These are specific phobia, social phobia, agoraphobia. The specific phobia is fear of objects or situation, for example, height, animal, blood, etc. The social phobia means social anxiety disorder, fear of social situation in any stage, speech, and the socialization, etc. Agoraphobia means fear open to crowd place. The next one is obsessive compulsive disorders. Obsessive compulsive disorder. OCD is a mental health condition characterized by two unwanted recurring thoughts, obsessions that are the causes of anxiety leading to repetitive behavior conversation, the person feeling to driven to perform to reduce the distress. These obsession and conversation that the significant of disrupt daily life. Example to obsession including fear of the contaminated or harms, well to compensation that involving to repeating hand washing, checking or mental ritual. The causes of OCD: serotonin imbalance, genetic factors, and perfectionistic personality traits. The treatment: CBT, exploring and to responding prevention, family counseling, and behavior modification. The next disorder is dissociative disorder. Dissociative disorder is an outdated term for the group of conditions that are to now the spreaded separated into dissociative disorder and conversation disorders, also known as the functional neurological symptoms of disorders. Both involves to physiological stress causes of physical symptoms that are not due to the medical condition. Dissociative disorders disparate consciousness, memories, or identify, while conversation disorders, the causes of symptoms affectly voluntary movement of sensory function, such as a paralyzed tumors or blindness. The types of dissociative disorders: the four types of dissociative disorder: dissociative amnesia, tuga, dissociative identifying disorders, conversation disorders. Dissociative amnesia means inability to recall importance of personal information. Next, dissociative fugue, that means the sudden travel away from the home with identity loss. Dissociative identity disorders: two or more distinct identity within the individual. The last types: conversation disorder. Conversation disorder is psychological conflict expressed and to neurological symptoms, paralysis, blindness without case. The another disorder is stress related disorder. The stress related disorder is two type: post traumatic stress disorder and act stress reaction. The post traumatic stress disorders developed after experience or witness to traumatic event, example accident, abuse, disaster. The symptoms: avoiding to talking of the trauma, avoiding talking of the trauma, essentially whiteness, negative thinking, flashback, nightmare, avoiding to reminder, hyper emotional numbness. The causes can be chronic if to untreated. The treatment: trauma focused CBT, medication, positive support therapy, and EMDR. Eyes movement desensitivity of the reprocation. The next is active stress reaction. Short-term psychological response immediately after to traumatic event. The symptom: shock, confusion, anxiety, insomnia. Physical symptoms like is palpitations. Duration is hour to the few days. Treatment is supportive counselors, reassurance, and rest. Next, adjustment disorder. The adjustment disorders means Emotional or behavior symptoms that occurring to response to identifiable stress like divorce, jobless, relocation, etc. The symptoms sadness, anxiety, irritability, sleeping disturbance, difficulty in social or occupation functioning. The physical symptoms means mm, muscles tension, anxiety and depression, sadness. The emotional symptoms. The duration symptoms appear with the 3 month of stress or to resolve in within 6 months after to end. The treatment is supportive therapy, problem solving counseling, short term CBT. The last and final disorder is eating and sleeping disorders. Eating disorders. Eating disorders types anorexia nervosa, bulimia nervosa, binge eating disorder. Anorexia nervosa, restriction of the food intake, intensive fear of gaining weight, destroyed body image. Next one, bulimia nervosa, recurrent binge eating following by puring, vomiting, laxatives. Next one, binge eating disorder, recurrent binge episode without purging. The treatment is nutritional rehabilitation, CBT, family therapy. Next one is sleeping disorders. The sleeping disorders, four types: insomnia, hypersomnia, sleep apnea, parasomnia. Insomnia means difficulty in initiating or maintaining sleep. Hypo, hypersomnia, excessive sleepiness. Next one is sleep apnea, breathing pauses during sleep. Parasomnia means nightmare, sleepwalking, etc. The treatment of sleeping, hygienic, relaxation training, CBT, medication. Thank you for listening.